A few years back, I had an idea of how to improve care for my anxious pediatric patients coming to the hospital for surgery. Today, I'm going to share the story with you of how I transformed this idea into a product that we're working to commercialize, and how working on this product transformed me into a nurse innovator. Working as a nurse practitioner in a preoperative clinic, I see kids every day who are terrified to go back for surgery. Research has shown that the highest point of anxiety for kids who are having surgery is when they roll back into the operating room on that stretcher and we place an anesthesia mask on their face to have them breathe gases and go off to sleep. When kids get anxious in that moment and start fighting the anesthesia mask, oftentimes parents or clinicians have to hold down their arms to get them off to sleep safely. As you can imagine, for kids, this can be terrifying. And for clinicians, this is something that we wish we could remove from our job description. Thinking about this challenge from the eyes of a child, I wondered if we could find a way to make the mask less scary by adding some element of fun. I envisioned a video game that was controlled by breathing into the anesthesia mask. I wasn't completely sure if kids would buy into this, and so I created a little prototype to give it a try. I bought an app that was controlled by breathing from the iPhone store, and I connected it to an anesthesia mask with a standard microphone. We then handed it to the experts, a bunch of kid testers. And I'll say at this point, despite some of the parents' requests, we did not include any anesthesia in this phase of testing. When I watched a little 2-year-old girl play this game for the first time, I was convinced that we were headed in the right direction. The app that we had bought was this little app where these ants crawl down the tablet screen trying to eat your food, and you have to blow them away. When this 2-year-old saw this game, she instantly picked up the mask and started breathing as she giggled and smiled, and her parents cheered her on. Instantly, this game had transformed a scary anesthesia mask into a fun game controller. Seeing the enthusiasm that parents and kids had for this idea made me think that it was worth creating, but a single conversation made me believe that it was actually possible. During a meeting with my research mentor, he asked me about what I wanted to work on in the future with research. I opened up my backpack and handed him this early prototype of the breathing-controlled app. I shared with them that every day in the clinic, I saw kids that could benefit from this device. And I really wanted to create an app that was optimized for preparing kids for surgery, and then a breathing sensor that we could actually connect into anesthesia equipment so that they could continue on playing until that last moment where they normally are highly anxious. But I had a few challenges. I didn't have any funding for this great idea, and I had never done anything in product development. Instead of agreeing that I didn't have the necessary skills to take on this project, my research mentor told me that he thought this idea was incredible and that we were going to find a way to get it funded. A few months later, he sent me an opportunity to apply for our hospital's innovation grant. As I read through this opportunity, I quickly realized that this kind of looked like a foreign language. Intellectual property, commercialization partners, FDA classification, they don't teach any of that in nursing school. But being a nurse, I was incredibly comfortable collaborating across different disciplines, and learning new skills and technologies is something that we do constantly being nurses. And so I set out to make connections across my hospital, and I gained insights from experts who were willing to help me, and together we wrote this grant. In 2016, I was the first nurse at Cincinnati Children's Hospital to be awarded a $100,000 innovation grant. This grant allowed me to work with a team of designers and engineers and computer programmers so that we could create the first prototype of this breathing-controlled app. 3 years down the line and several grants later, this product is being tested in the operating room, and we're working towards making it available to hospitals across the country. The greatest reward from this work is seeing these anxious little patients who initially are scared of the mask become comfortable enough with it that when they roll back to surgery, they're actually willing to hold the mask themselves to fall off to sleep. Looking back, I think that being a nurse practitioner leading this project gave me some great advantages. Working in the clinic, I had direct connections and constant input from our clinicians, our parents, and most importantly, the kids. They're very honest about whether they like things or not. This feedback really kept us moving in the right direction. Along the way, I also had impactful stories from the bedside to share with my team, both the ones in the clinic and those who don't see patients at all. And I think that this really brought us a sense of unity and purpose to this entire teamwork that we were doing. My hospital awarded the innovation grant so that we could create a product to help kids. But by awarding this grant, what they also created was an incredible new role for a nurse innovator. Thank you.